Gary Slutkin, the founder and CEO of Cure Violence, is with me now. And I know violence is such a pervasive problem in our society now, but it's not just about victim or perpetrator or certain neighborhoods, although I don't think most Americans really understand that. So could you really verbalize how violence is such a public health threat to everyone?
Well, first off, we should realize that violence is the second leading cause of death among our young people. So young people are ordinarily thinking that they may die of violence the way older people are thinking that they may die of cancer and heart disease and so on, and that's accurate. The way that it affects all people is that everything is suffering economically because of it. And also we're unable to go everywhere, and many people are feeling the fear of it when it's in our city or in places that we don't know about. The costs of this are astronomical. I mean, the costs are to the country is in the hundreds of billions of dollars. So we're paying, I mean, in Chicago, for example, it's thought to be a $2.2 billion bill for the taxpayers.
That's absolutely huge.
And this is reversible. This can be reduced enormously through health methods and methods like it, yeah.
Let's talk about that, the idea of addressing violence, because I think the public perception they see in the media is policing strategies, but there's really so much more to it in terms of addressing that violence.
Well, we've actually been looking at violent behavior wrong. We've been not yet considering it as a behavior, like eating behavior, or exercise behavior, or smoking behavior, or sexual behavior. And when we think about it as a behavior, which is really the specialty of health people, we realize that people pick up their behaviors from others, and that there are means for reducing the risk behaviors. And that's kind of our specialty, and that's really what the Cure Violence method works on. In fact, we've gotten deeper into understanding this, and we now see that it's really directly contagious by nature of seeing a lot of it.
And that's what I was going to ask you when you talk about those behaviors, what contributes to them? It's just a cycle that goes on from seeing the parents and grandparents in the same way, in the same neighborhood?
The main contributor of violence is being exposed to it. And it's largely by seeing it and being victimized by it. So the brain actually processes the seeing of it and having been traumatized from it, and produces more of it in the same way that the lungs produce more TB when it's exposed to it, and then it replicates and produces more of it, or the intestines produce more diarrheal diseases and then pass it on to others. So this is the new science that the Institute of Medicine has validated that shows that it's behaving like a contagious disease. And that gets rid of the idea of violence as a property of bad people, but just simply a contagious issue.
What would you say to people who say, they look at the name of your organization, Cure Violence, and you say it is preventable, to people who are just so pessimistic and think, there's nothing we can do, it's been a cycle that's been continuing for years?
Well, the efficacy of health-based approaches now has been demonstrated. I mean, just the Cure Violence method has been shown to reduce shootings and killings by up to 70%, and to reduce retaliations by up to 100%. And this has been in Justice Department studies and Hopkins studies and CDC studies in multiple cities, and actually even in other countries. So the ability to recruit and train new types of health workers who have a lot of credibility and access to the population doing it, these violence interrupters, outreach workers, hospital responders, this combination of controlling epidemics has resulted in neighborhoods. I mean, in the Englewood neighborhood in Chicago, there was a 70% drop in July with this method, when it was going up by 80. In Baltimore, there's 3 neighborhoods that have gone over a year with 0 shooting. And so Baltimore is going to this method. New York City, half of their at-risk neighborhoods are now going to this method. Kansas City, New Orleans. Health departments are now managing violence when they weren't, say, 5 or 10 years ago.
So you say you need all the people in public health and all the healthcare workers. How do you recruit them?
Well, the recruitment is done in the same way that we recruit health workers for reducing Ebola, reducing HIV/AIDS, or reducing child mortality in difficult situations. We find people from the population who are trusted, and who have access, and who are believable, and who are the people who are thinking about doing it or thinking about doing behaviors, whatever, violent behavior or other behaviors. They can see that the person talking with them is talking to them in their own interest. And then they're giving them new information, and they have themselves skills in cooling people down and changing the way they're thinking about it, buying some time, interacting with their friends, and helping them essentially not do it. That's how the method succeeds. That's how Cure Violence, that's how the health method succeeds.
And these are people who want to make a difference, and clearly you're saying there is hope to make a difference. Gary Slutkin, thank you so much.
Thank you so much, Dina.